Now, as we continue to look back on a year of lockdown and COVID-19, we shift our attention to media coverage. From social media to TV to radio, it's certainly been a year dominated by the pandemic. Inevitably, fake news entered the conversation. The World Health Organization refers to this as an infodemic, with too much information, including false and misleading ideas, shared unchecked during the virus outbreak. A year on, what have we gotten right in South Africa, and what do we need to work on? I'm joined via Skype by Mia Malan, the Editor-in-Chief at the Bhekisisa Centre for Health Journalism. A very good afternoon to you, Mia, and thank you so much for your time. So, 365 days of sharing information, trying to debunk these myths that this is a virus that, of course, was created so that people can be bugged and that, the eye up there can follow people and essentially just spy on us. So, have we gotten it right, not only as the world, but as South Africa?
I think when we look at whether we got it right, we do need to acknowledge the context in which this happened, that COVID happened so fast that it turned all journalists into health journalists overnight, and that didn't necessarily mean that we got the skills overnight to be able to do that. So if you look at did people use the media more during COVID? Then I think all the spikes in readership figures that we've seen, not just in South Africa, but around the world, clearly indicates that people relied on the news media much more than before when the COVID pandemic started. Now, to evaluate how we performed, you need to look at different levels of reporting. So studies show us that when a pandemic happens, people want three types of knowledge. The one is just basic knowledge. In other words, what do lockdown rules say, where to get tested, how do people protect themselves? And then they want information that's a little bit more contextualized, which includes reasoning, for instance, behind lockdown rules. And the third type would be accountability, to make sure that the government does its job and whoever else needs to do things. Now, if we look at the first level, just basic information, I don't think we performed badly at all. You may recall at the beginning of COVID, television stations such as yours had public health messages all over for weeks. And it wasn't so hard to get the information right there because the World Health Organization and even the government with the coronavirus website had lots of information that sort of could be copied and pasted. What we didn't see on that level is messages in all the 11 languages of the country. So that, I think COVID was an opportunity for an English television station to have more languages so that the messages can reach more people. And that we didn't really see, but we did see many dashboards. Many media organizations had dashboards that would tell you how many infections there were per day and how many deaths and that sort of thing. When it gets to the second level, it gets a lot harder to report because it requires more knowledge to provide context, and especially a little bit of scientific knowledge, which is hard if you weren't trained that way as a journalist. So if you, for instance, had to explain, was the ban on alcohol sales in the country successful or not, and why do we have it, you need to be able to understand research methodology and the links between alcohol and trauma and the drinking habits of South Africans. And on that level, we have seen inaccurate reporting and sometimes a little bit almost like unbalanced. So if obviously the alcohol industry had an economic impact because of this, but if you look at it in a broader picture, they're not just victims, there's also a responsibility, and to be able to see that, you need to understand the research around it. So I think that was hard for us as the media. The third level of accountability was almost a little bit more suited to the skills that already existed. So the big accountability issue was corruption, right, with the PPE procurement processes. And investigative journalists already had a knowledge of procurement processes and how to investigate the documents around that. So I think the media did pretty well there, but accountability really goes further than just reporting on corruption. It also involves sort of looking forward and looking at processes of approval and whether the government is moving fast enough, for instance, with vaccine plans. And with that, it's difficult again, because if you want to, for instance, report on why did the Pfizer vaccine in South Africa get registered before the J&J vaccine, we only have research registration for J&J, but for Pfizer we have wider registration. It requires you to understand how our medicine regulator, SAHPRA's approval processes work. And I I've sometimes seen in traditional investigative journalists sort of trying to uncover Gupta-like angles here, when it's often a process that needs to be understood, and that is just playing out the way it's always played out, but now it's under the spotlight because there's the pandemic. So I think, in summary, when an understanding of health processes or health systems or science and research methodology is required for some levels of reporting, it gets much harder to get it right and to provide a well-rounded picture. But all in all, I don't think the South African media has done a bad job. I just think it gets a lot harder if you're not a specialist in the health area.
Of course. Mia, we are well over time, but I still want to squeeze in this question. The rollout of the vaccine in this country, there are a lot of people who believe that there actually is no rollout of the vaccine. There just is a lot of media hype. Do you think we're getting it right as a country in terms of the rollout?
You know, that's a very hard question to answer, because if you want to ask, are we getting it right, many people would one of the measurements would be that we would have had to start earlier. But if we look at where we are now, we had an early access sort of rollout through the Sesonke study, and now we're at the stage where we need to get more vaccines into the country, and the big question is, which vaccines will we now get? Now, we can only get vaccines into the country that has been registered with SAHPRA, our medicine regulator. There's 2 vaccines registered, AstraZeneca, we're no longer going to use that, and Pfizer for wide rollout. So most likely our next step is going to be Pfizer, and we know the health minister said in Parliament 2 weeks ago that he's expecting in the next week 600,000 Pfizer vaccines, some from COVAX, some from Pfizer. It's hard to know if that exactly is going to happen. We would certainly hope so. And what we as the media would now need to do, our reporting ahead, is we would need to start to ask questions. We want to see a site list where there are going to be 2,000 sites they've announced that these vaccines are going to be distributed at. I would love to see where. I would want to see how are they going to get distributed. And I'd certainly want to see, have they put cold chain requirements in place, because Pfizer requires different storage environment than the J&J vaccines at the moment. That's what we can hope for now. The rest, we really don't have specific dates for when which vaccine is going to arrive. We only have quarterly estimations.
Of course.
Is that fast enough? You know, I think it's what we can do at the time. It's what we can do with how many vaccines are available in the world, how many can we get because we started to procure a little bit late. We can really just, what we can do in our power at the moment as the media is to put pressure on, are the processes in place to distribute these vaccines when they arrive.
Most definitely. Mia, thank you so much for your time this afternoon. That is Mia Malan. She's the editor-in-chief at the Bhekisisa Centre for Health Journalism.